Hello, I'm Dr. Michelle Messner with Creekside Animal Clinic, and I'm going to tell you today about my thoughts on post-operative care of your pet after they've had surgery done on them, a dog or a cat, and what to look for and what to be cautious of. The most important thing is when you pick your animal up after the surgery, you're going to probably be given either verbal or hopefully written instructions, and you need to read through those instructions and see what the doctor wanted you to do post-operatively. If they were given medication in the hospital, you want to find out when the next dose is due if they send you home with medication. If you have any questions, ask the person who releases your pet to you, and make sure that you have it all straight in your mind before you leave the building. When you get home, your pet might still be a little wobbly from anesthesia, and also the fact that most veterinarians today use very good pain control on their pets when they have surgery. Because of that, they're still wobbly, a little bit off. You don't want to let them around small children because they might be a little bit nervous and anxious and possibly hurt the child, or they might fall down the stairs if you let them go near the stairs. So keep an eye on them immediately after you get home. Don't feed them a lot when they get home. A lot of dogs are fasted, and cats are fasted before surgery, and a dog like Crew here will come home and gobble down a big bowl of water and eat a bunch of food, and then he might throw up in the middle of the living room. That's just one of the hazards after surgery. So a small amount of food, a small amount of water, and then go on from there. Later on in the night, he can have a bigger meal. Crew's already nervous, and he didn't have surgery today. So if they tell you to keep your dog in a crate after surgery, usually we don't crate cats, but your dog in a crate. Let's say Crew had a knee surgery done, which is the most common orthopedic surgery in dogs. He would have to be crated because he doesn't want to beat up that surgery site. He might have an Elizabethan collar on, a big lampshade type collar to keep him from licking his incision. The biggest damage a dog can do to their incision is licking it with their tongue, scratching it with their feet, or running around and knocking it into things because they're just acting like a dog. So you need to keep him in the crate if that's done. If this animal damages the surgical site, there may not be another option to fix it right away, and there may not be an inexpensive repair. It may cost you twice as much as you spent in the first place. Make sure you follow all your recheck appointments, and when you go in to see your veterinarian, you can ask further questions. Never be afraid to call. A lot of times a dog will come home with a bandage on. Let's say Crew had knee surgery and they had a bandage on. Stand up here, Crew. So in that case, he's going to have a bandage on this part of his leg right here. Well, this leg is shaped like a funnel. It's hard to keep that bandage on. So sometimes, even though we put a little bit of tape on the hair, the foot will swell below the bandage. If his foot is swelling below the bandage, that bandage needs to be loosened or come off. If the bandage gets smelly or dirty or wet, it will need to be changed relatively soon so that it doesn't damage the incision. A lot of times bandages are put on to keep the animal from licking. You might have to switch from a bandage to an Elizabethan collar if the dog will not keep a clean bandage, or he wants to go out and if it's in the winter, it gets wet, or it's a rainy day. If the bandage is on his chest, you got to make sure if it's a boy dog, it doesn't slide over the end of his penis so he can urinate. If it's a girl dog, it'll slide back down around her waist, and if the wound's up here, it's not going to be helpful. So bandaging a dog is a difficult thing in the first place. But the owner needs to be aware that that bandage needs to stay clean, dry, and free of odor. If it's smelly, wet, or dirty, it probably should be changed. If the limb below the bandage, if the foot below the bandaged leg is swelling, it needs to come off and be replaced. Otherwise, you can do damage to the lower part of that leg. The other thing you need to be aware of, you need to check the incision every day if you can see it. If it's in a bandage, you need to touch the bandage and smell the bandage. Make sure it's not wet or smelly. If you can see the incision, it should be clean and dry. There shouldn't be any oozing from the incision. If there's oozing, you need to call your veterinarian and set up a recheck right away. If they're not open, emergency clinic if there's lots of oozing and redness. If there's a little bit of blood and oozing the first day, that's usually fairly normal, but after the first day, it should be sealed. The most itchy part of bandage wound healing, not bandage, but wound healing is the 4th day up to about the 7th day it itches. So that's when you really got to watch them for scratching and licking and chewing at that site. Stitches usually come out in 10 to 14 days, not like people at 7 days. They have to stay in a little bit longer in a dog and a cat, and if they have stitches, take them to your veterinarian to have them removed unless you're familiar with how to do that. If they don't have stitches, you got to watch them for at least that period of time. So keep your follow-ups, follow the instructions, treat pain. Biggest thing I worry about is bandage control and wound control, so watch those two things and call your veterinarian if you have any questions. Please come see us on our Facebook page or our web page, creeksideanimalclinic.net. Once again, I'm Dr. Michelle Messner. Have a nice day.